Okay, so what I learned about my 27-year-old lady who came in here for just a regular checkup today said she was feeling fine. She had no recent weight changes, no fatigue. Everything seemed to be just fine. Her skin was elastic. Her skin turgor was elastic. She has a pale skin color, but it's just her complexion. She has nice pink skin. She has warm, dry skin, and with her hair, she has evenly distributed follicles all throughout her hair, no patchy spots. Her scalp was very hydrated, and I did not see any dandruff or any flaky skin upon my assessment. When looking at her nails, I did not see any blue discolorations to the nail beds whatsoever. There was no clubbing. They looked very healthy and very well groomed. Whenever I was inspecting her head, it was normocephalic. There was no lumps or lesions, and cranial nerve 7 was present. With her face, it was symmetrical. I didn't notice any swelling, and whenever we did the test, there was no weakness on either side. With her eyes, her visual fields were full by confrontation. Pupils were 3 millimeters when they were resting, but they were about 2 millimeters whenever they were constricted. Perla was in both eyes, and she presented cranial nerve 2, 3, 4, and 5. The sclera in her eyes were white. The sclera in her conjunctiva had no discharge, no redness, no lesions, nothing noted there. The fundi, the vessels were present in all 4 quadrants without crossing defects. Her ears, there was no masses, lesions, tenderness present. There was no wax present or any type of discharge coming out of the ear, and canals were open and clear bilaterally. With the nose, there was no deformities and no tenderness noted. The nares were both patent. The nares had pink mucosa, no lesions. The septum was midline with no perforations, and cranial nerve 7 is present. With her mouth, she had a pink and moist, soft and hard palate, and it looked to be intact. She said she's had no problems with any tenderness or anything giving her trouble in that area. Her oral mucosa as a whole was moist and pink and no lesions once again. Her tongue was symmetric and also moist. She does not have any tonsils due to a past tonsillectomy years ago. Her pharynx is pink with no exudate noted. Her uvula is midline. With her neck, she presents with full range of motion in both sides, and there was no masses or tenderness noted. The trachea was midline. She had a non-tender thyroid whenever it was palpated, and she said she's had no problems with that. Flat jugular veins. She didn't have any bruits that I could hear from listening to her carotid arteries. Cranial nerve 11 was also present. Now, with her spine and her back, whenever she was touching her toes and I was looking at her spine, she had a very straight spine. I did not see anything protruding or no curvatures noted on her spine. Whenever I asked if she had any CVA tenderness, patient denied the tenderness there. She said she's never had any problems with her spine, so today we did not find anything wrong with her spine. It looked really straight, and it did not look like it was giving her any problems. With her thorax and her lungs, her AP diameter was less than her transverse diameter. Whenever I did the tactile firmitis, it was equal bilaterally. Her breath sounds were present with equal effort in all lobes of the lungs. With her breast, they were symmetric. I did ask the patient if she had any problems with her breast, like if they had been tender, has she felt lumps, has she had any discharge coming out or anything unusual that would spark interest that we need to look into. The patient denied any discharge, lumps, lesions, pain coming from either breast, but we did note that they were both symmetric. Her heart with the precordium, there was no abnormal pulsations noted. Her apical pulse was noted at the 5th intercostal space at the midclavicular line. There were no thrills. S1 and S2 were heard. Luckily, S3 and S4 were not heard. Whenever I palpated her abdomen, she had a flat, symmetric stomach. Bowel sounds were present in all 4 quadrants. She had no bruise. She also had no lesions, lumps, or tenderness. In her extremities, her color again was pale and pink. No redness or cyanosis noted. No lesions on any extremity. All her peripheral pulses were present. Bilaterally, there was no edema anywhere on her skin. Her brachial pulse, her radial pulse, all that was present, and it was a strong pulse. With her musculoskeletal system, her temporomandibular joint had no crepitation noted. Her arms and legs were symmetric, and they had full range of motion. She had no pain in her neck. That the patient denied any pain. There was no tenderness in the muscles upon flexion. She denied the pain. Neurologic assessment, her appearance, her behavior, and speech all were appropriate for the exam that we're given today. She was alert and oriented ×3. Her cranial nerves 2 through 12 were all present. There was no atrophy or weakness or tremors. She had a steady gait, and she had a negative Romberg sign.